I'm doing well. And I stumbled upon you because I was looking at the hashtag from adenomyosis and I was looking for answers regarding myself.
Mhm.
And I was having trouble finding anything on Google, a lot of information. So I said, you know what? Let me go on Instagram because that seems to be where the communities live. And sure enough, your Instagram was the first that I found. And I found it to be a plethora of information and knowledge for me and also comforting. So thank you for what you're doing for awareness.
Oh, well, no, thank you for saying that. I'm so glad that you did find me. And, it's one thing that is the reason that I created this page for, because as you say, you go on Google and you have a look, and it's almost like you can see the tumbleweeds drifting past. There's really not much out there.
No.
So, yeah, brilliant that you found me, and thank you for having me here.
Of course. And for people who are saying, wait, what did Diana just say? Because if you're on EndoTV, you're thinking, I know endometriosis. I've heard of it. I have a vague understanding. I did a recent poll on my Instagram and I said, it's March, it's Endo Awareness Month. Who knows what endo is? And 85% of my followers, which would make sense, right? 85% know what endo is. But adenomyosis, which is a mouthful too. What exactly is that for those that don't know?
So, for those that don't know, I think actually it's quite helpful to use endometriosis as a benchmark. Adenomyosis is often referred to as the evil sister, let's say, of endometriosis. They're same, but different. So, adenomyosis is when cells from the endometrial lining, so the lining of your uterus that, the cells that come out in a period, the cells from that endometrial lining migrate from that lining into the muscle wall, the myometrium of the uterus, which is obviously where they're not meant to be. And the trouble is that once these displaced cells are in the myometrium, they still respond to the hormonal changes that go through the body. So when it gets to, certain periods of the month, they break down, they swell, they bleed, but they don't have that route anymore to exit the body. So it can cause a whole heap of issues. Firstly, a hard and enlarged uterus because there's bulky bits of tissue there that really should not be there, but also extensive pain, heavy bleeding actually for a lot of women. And it spills out into other symptoms as well that you wouldn't necessarily expect. At least I certainly didn't when I first started looking into it. Bowel issues, bladder issues, fatigue, which is often related to anemia, which is tied into the heavy bleeding. It's kind of the sort of snowball effect. But yeah, I think the evil sister of endometriosis is actually quite helpful because whilst endometriosis isn't actually those endometrial cells, it's cells that are quite similar and mimic. These ones are, but it's helpful, I think, as a benchmark to sort of establish what adenomyosis is.
Mhm. And for you, when did you realize that something was wrong?
Good question. I think, like a lot of us who have been diagnosed with adenomyosis, I started having symptoms probably a good 8 to 10 years before I was actually diagnosed, essentially from my first period. And I was 13 years old. I'm now 27.
Mhm.
I was diagnosed with adenomyosis eventually when I was 24. But throughout my teen years, I had really painful periods, but your sort of society tells us that they are painful. You see, you see adverts of women clutching their stomachs, and it's sort of normalized that. Well, actually, you also see adverts of women playing tennis in white mini shorts, but
Right,
but
smiling.
it's sort of normalized. And period pain is something that I think we all go, oh, my mum used to have really bad period pain, or my auntie did. And it's hard to know where your pain fits on the pain spectrum because pain
Mhm.
is subjective. And I think, you put up with this pain, at least I certainly did. And a lot of my followers who've reached out to me have said the same. But I had very bad periods throughout my teens. And around the age of 17, 18, I started to have quite sort of severe bowel issues as well. Went to the GP, and for years and years and years, I had the age old, oh, you've got IBS. You
Mhm.
know, it maybe try cutting out gluten, try cutting out dairy. It was all considered gastroenterological. I can't get the word out. It was all considered to be gastro related. rather than gynae related. And then eventually I started getting recurrent UTIs around the age of about 22, 23. And so I was then referred to, and I got kidney infections off the back of them. So I was then referred to a kidney specialist who did all sorts of tests, found nothing, back to my GP, my general practitioner, who diagnosed me with various things that I didn't have, pelvic inflammatory disease, all sorts again, until eventually I pushed and pushed and pushed and was referred to a gynecologist with expertise in endo. I, at this stage, didn't know what adenomyosis was,
Mhm.
but he then referred me for some scans. And at age 24, all these years later, I finally had a diagnosis of something I'd never even heard of.
Mhm. And did they explain how adenomyosis would correlate between your symptoms? Did it have anything to do with the UTIs or bladder, or was that endo?
The trouble is, they just don't know. I think for my adenomyosis diagnosis came first. It was a year later that I then was diagnosed with endometriosis, and I now know that I don't have endometriosis around or on my bladder. So the lowest common denominator is that it was what was causing that sort of bladder pressure or potentially the UTIs. Um, but nothing was quite certain and nothing was quite sure. And I think that's the trouble I really found with first being diagnosed with adenomyosis, because this was back in 2018, which admittedly doesn't sound that long ago. But in terms of conversations around these sorts of topics, there was, you think there's nothing on adenomyosis on the internet now. There was nothing then. And it was a weird moment getting the diagnosis, because they said, "Oh, that's what you've got. It's a bit like endometriosis. It's probably why you're in pain. Bye bye." That was sort of it. There was no plan, there was no breakdown of quite what it was, quite why. And I think that's what makes it really difficult with, the female pelvis anyway is a very complex area and a complex system, and a lot of things come into play. But, since that as a no diagnosis, I then changed what I was doing in terms of contraception, in terms of pain management. And actually, since then, I haven't had any of the bladder symptoms. So
Oh.
one can only assume it was, but we'll never know for sure.
Did any doctor advise you on management at all?
So the doctor that I am with now is brilliant, and he does advise me on that. I now have a marina coil, depending on how you pronounce it, which ironically I had at the time of my first diagnosis, and it was really exacerbating the symptoms. And I had that taken out as part of the investigations to see if perhaps that's what was causing my pain and my symptoms. And interestingly enough, since having later a laparoscopy for endometriosis and having all the sort of tissue that was in there removed, it had gummed my bowels to my pouch of Douglas and to the uterus, and having all that sorted and separated, my endosurgeon said, should we consider putting the Mirena back in? Which I was loath to do, because I thought it was awful for me the first time, and it caused, in my mind, caused all these issues when in fact it probably hadn't.
Mhm.
But since then, I've had that put back in, and that's what I'm currently using alongside non-steroidal anti-inflammatory naproxen to manage the pain, and the Mirenas to sort of manage the adenomyosis for the time being.
Mhm. And I've read online, and again, I'm not trying to put you in a position of being a doctor or anything like that, but they said a potential cure and only cure is a hysterectomy
Right.
for adenomyosis, which we know is not a cure for endo.
Right. So this is what comes into play with this same but different idea with endo and adeno. Endo is in some ways easier to treat than adeno, because you can treat it surgically through laparoscopy. You can ideally excise the endometrial tissue. It's not a cure, but it's a way of managing it slightly more effectively over time. Adeno is not quite that simple, but you can cure it with a hysterectomy because, unlike endometriosis, adenomyosis is a uterine condition. It is confined to the uterus, and therefore removing the uterus removes the problem.
Mhm.
But that's not much consolation for a hell of a lot of women who have been told they have adenomyosis. Great news, there's a cure, but you've got to have your uterus removed. Well, I'm 27. I don't have children yet. I do ideally want children one day if it is possible. That's not that's not a cure to me in my current state of play. So it can be cured by a hysterectomy, but for a hell of a lot of women, that's really just not an option.
Right, right. No, it's a very difficult position with these illnesses because that's not really, it's a cure you never want to hear about because even if you have children or don't want children, removing body parts isn't really something, or organs is something that anybody wants to do if they don't have to do it. So it's very unfortunate that we haven't done more research and found more solutions than, oh, let's just remove your uterus. That's the only thing that we've got going for you right now.
Yeah. And I think a lot of that is related to the fact that until recently, adenomyosis was very difficult to diagnose.
Mhm.
It is now diagnosable via either a transvaginal ultrasound or an MRI under the eye of a specialist, bear in mind. But that it can be diagnosed that way. But that's really recent in terms of technology. So historically, the only way to definitively diagnose adenomyosis was post hysterectomy, a pathology of the uterine tissue, which I think has had a huge snowball effect on both the understanding of adenomyosis, understanding its prevalence, and understanding who is affected by it. Because when I was first diagnosed, just anecdotally, I was told, gosh, that's very unusual. It only ordinarily affects women in their 40s or 50s who've already had children.
Mhm.
Now, the reason that we probably think that and knew that is because it was those women who were having so much pain. A solution was potentially to have a hysterectomy. So they opted for that. The pathology was underwent, and so they had a diagnosis. Whereas women in their teens, 20s, 30s who still want children, having severe period pain, just kind of got on with it. They had
Mhm.
to. Hysterectomy wasn't an option. And what an outlandish suggestion. Oh, you've got bad period pain. Let's just whip it out. So I think the fact that you couldn't diagnose adenomyosis without a hysterectomy until really recently has had a huge detrimental impact on women of today.
Mhm.
And in terms of recognition, and it has really skewed the balance of the information that's out there. I mean, for example, I was looking at a few studies, and one from 2013 said that adenomyosis affects between 5 and 70% of women.
Oh,
That's not a stat.
that's not a stat.
That's not
That's
a stat at all.
huge breadth of difference.
Huge, huge. And like endometriosis, a lot of sites and studies say that 1 in 10 women are believed to be infected by adenomyosis. Affected, apologies, not infected. But then a study in 2019 looking at the prevalence of adenomyosis in women with endometriosis already was between 20 and 80% of women. Again, it's not a stat, it's not a usable stat, and it's not a reliable stat because you kind of think, I'm in no man's land here. I've got no idea if this is hugely rare, hugely common.
Mm.
I don't know where I stand. And I think because, as I say, until recently, hysterectomy was the only real way to diagnose this, prevalence studies haven't really been conducted because there's been no mass way to do it until recently without having had women with hysterectomies. And it's really skewed the figures that are out there.
No, that makes complete sense. And I've also, on just a pain symptom kind of checklist, I've heard it can progress. It can get progressively worse.
Yes, I mean, again, I preface this with the fact that I am not a doctor. So this
Right.
is just in terms of my research, and thankfully I have two, I say two parents because I've got four parents. I've got a dad and a stepmom, mum and stepdad. But I've got two parents that are medics, and so I, whilst not being medically minded myself, I do have these resources and language that I find some medical stuff a bit more accessible, and I can refer to them. Um, but in terms of adenomyosis progressing, it seems that it definitely can. And my, uneducated assumption is because, we have periods month on month. It exacerbates month on month. It was described to me by my surgeon as this, if you imagine a bunch of grapes sort of shriveling and swelling, that's sort of how adenomyosis works. So they can keep swelling and swelling and swelling. And obviously, the uterus muscular wall gets bumpier and bumpier depending on what type of adenomyosis you have, either lumpy or, enlarging on the whole. If you don't take, hormonal treatments to address it, it is conceivable that it will carry on progressing. And that's also something that's heavily contested because no one wants to be told you have to have hormones pumped into you in order to control this particular condition. And some people do find that um, alternative therapies or exercise or other methods of management help them, and that is brilliant. But it's really not one size fits all, and it can progress over time.
And it doesn't necessarily mean that if you do the hormones that it's going to, let's say you're already at a 10 pain and you start doing hormones, it doesn't mean it's going to bring it down to a 5. It just might hinder it from, we think, potentially progressing, so it's worse.
Yeah, exactly that. And the trouble is that it can hormonal treatment can help to regress it, but it doesn't mean that that's going to have any necessary correlation with pain. It's the same, much like endometriosis. They say the severity of your endometriosis doesn't necessarily have a bearing on the
Mhm.
pain that you might feel. So, a third, again, a stat that's heavily called upon, I'm going to use it loosely, but a third of women supposedly with adenomyosis are asymptomatic, and they only discover they have it whilst having tests for
Mhm.
other things or perhaps a hysterectomy. And theirs can be really advanced. So actually, as you say, the pain doesn't really have a bearing on the level of the condition. So hormones can mask symptoms for the lucky ones that it does mask symptoms for. But again, there's no guarantee.
I spoke to a friend who has endometriosis, and I was telling her about adenomyosis, and she said, I've heard that that pain, and again, subjective, she said, is a beast, is like a complete beast that is its own separate kind of pain from endo. And when she said that, it clicked with me because I have endo and I've had it, for a while, but this pain was all new to me and I knew it was something different, but I
Mm,
couldn't quite put my finger on it. I just kept thinking something stuck somewhere. So because the pain would radiate into my flank area. So I thought, oh, it's my ureters. That's what it has to be. I already had problems with them before with endo. So it's back. And then the pain was in the front and in the back and down my thighs. And it was so different.
mhm,
And nausea, so much nausea.
mhm,
Uh,
mhm.
but again, it was similar but different to my endo symptoms. And I felt like they were even more persistent and more angry, if that's a way to explain it.
Angry. I have actually heard various specialists refer to adenomyosis as angry uterus. So I think you're, you're onto something there.
Yes. And having you on, I just really wanted to give voice to what you're doing because I think the same way that endo, is now associated with the yellow ribbon and there's awareness and there's the 1 in 10 campaigns. And I just want adenomyosis to have the same awareness because even though they're hand in hand, they are contrasting and there needs to be more research. There needs to be more than just take that uterus out because that isn't a simple solution. That's a huge decision and it comes with a lot of implications. And individuals are not just their ability to carry a child. There's other reasons why you have an organ there. So it's such an individualized decision, and it's too bad we don't have more options to get
Mm.
people out of pain.
No, and I do really thank you for, having me on and using your platform to raise awareness about this, because one of the reasons that I started my page back in 2018, and the reason that I called it Acknowledging Adenomyosis, was because it didn't have its own identity. It didn't have its own sort of time in the sun. I mean, we're now told that April is Adenomyosis Awareness Month, and that's great. But people still haven't heard of it. It hasn't had the sort of publicity that endometriosis had. And I know that that was lacking for several years and arguably still is in a lot of ways. But I don't know what the sort of state of play is over there in the US or perhaps globally, but in the UK, when I first did what everyone does, you get a diagnosis, over to Dr. Google, find out what this is. And adenomyosis didn't have its own page on the NHS website, which is our sort of main health system. It has to date not got its own page on the NHS website. Certain hospital trusts have done their own little information leaflet, but there isn't a universal one. And when you Google adenomyosis, it either comes up as a subpoint underneath endometriosis or a subpoint underneath hysterectomy.
Mhm.
Now, to me, that's awful, but you Google adenomyosis, and one of the top three hits is hysterectomy on the NHS. Why might you need this? Adenomyosis. That is terrifying for someone that's just been diagnosed to think, oh my goodness, this is going to be what I need. This is why people have this. And so I think acknowledging adenomyosis, giving it a voice in its own right, is crucial, because a lot of women have adenomyosis who don't have endometriosis. So
Mhm.
even though some of the symptoms and treatments in terms of hormonal treatments are very similar, reading a subplot on a huge endometriosis point doesn't resonate with them. It doesn't help them. And they're not entirely sure whether it's actually speaking to what they have. And it does need awareness in its own right. And I think, again, anecdotally, I found out recently that one of the leading endo specialists in Australia is using my adenomyosis symptoms posts as a patient leaflet for his patients that he diagnosed. And whilst half of me was delighted and thought, well, that's brilliant, I'm really pleased, it's more awareness, I've done something good. The other half of me was devastated and thought, but I'm not a medic. I'm a
Right.
27-year-old girl from London who researched this and did this in her own time. And it's being used by medical professionals because they don't have the
Right.
patient information leaflets that they need. They don't have the resources that they need. So they're going to Instagram for this stuff. And I think it is really high time that adenomyosis was acknowledged as something in its own right. Yes, it's endometriosis' evil sister, but you don't talk about endometriosis as adenomyosis' evil sister. Endometriosis has its own identity, and as of yet, adenomyosis is really lagging behind.
Well, I hope that in, let's say, a year from now, we grow leaps and bounds because of your mission that you created and
Oh,
because
thank
of
you.
what you've put out there. I found you in a time where, and I still feel lost, but less lost because of what you put out there.
Oh,
And
thank
and
you.
I felt more. I didn't feel like I was going crazy, because at a certain point, you really do feel like maybe that's it. Maybe I just snapped. It is a pandemic. Maybe I've snapped. So
Which would also be understandable, but is not the case.
right, it's not the case. But your body, and you know when something is wrong, and we always have to be our best investigators and researchers.
You have to be your own advocate. And unfortunately, that is the state of play at the moment. Hopefully, we'll get to the point that you go to the doctor and you say, I've got this crippling pain, I'm having a period and I'm vomiting, it hurts so much. Or, a lot of women saying, I'm passing out, I can't get out of bed, I can't move. You still have to push for that. It's not like you go in and say that and they go, right, let's do this, let's do that, let's do the other. They go, the pill? that's still happening.
Right. Or the other question that I love is, are you stressed?
Yeah, yeah.
Like, I've gone through a lot, but this is totally different.
Yeah, yeah, you're making me stressed by asking that, but
Right, right. So again, if you could give someone who thinks they're having we skipped tongue tied on that, adenomyosis symptoms,
Mm.
what advice would you give them if they have a doctor's visit ahead?
If you've got a doctor's visit ahead, I think you need to go with a list of your symptoms, because it is oh so easy in that moment to actually forget the little nuances in your symptoms. You know, you might mention, oh, I have bad period pains and bleeding's quite heavy. And you forget that actually, whenever you're ovulating, you always get a really awful pain right in the pit of your stomach, or the fact that you get really bad constipation, diarrhea in the lead up to a period. You might not notice those things in that moment when you're being asked, but keep a diary, log your symptoms, and go in with them. And I think go in armed with the words, could you check me for adenomyosis? Could you check me for endometriosis? Could we consider this? Because I feel like knowledge is power. And if you go in showing that you know what you're talking about and you have suspicions and you know your body best, and you ask them, can we check for this? If they then say no, you're in a position to ask why. And you're in a position to advocate for yourself and push for the treatment, the investigations that you need. I think going in blind is the wrong phrase, but going in empty-handed and just hoping that they can wade through the nuances of your language, because we all are guilty of it. You might speak in quite a sort of garbled, jumbled way, and it's hard for them to get through to what it is that you're actually telling them. Go in armed, go in with a list, go in with things that you know you're going to say and you need to say. And if you're not acknowledged, if you feel like they're not taking you seriously, get a second opinion. Don't accept it as gospel that it's all in your head, because I think it's hard, but I think it's so easy for us to accept what we're told. And it's hard to push against it, but you have to, because you can't go on like that. You can't go on like that. And those symptoms, you know that those symptoms aren't normal.
No.
Period pain can be normal. Twinges, paracetamol, ibuprofen should kill it off for the most part. If they don't, there might be something else going on, because you shouldn't be writhing around, vomiting, passing out.
No. And also, I think you mentioned something too, that you can also have pain during ovulation. So for me, I get pain almost for 2.5 weeks
Yeah.
of the month.
Mhm.
Where it's just I have like one good week and I'm like, oh my gosh, I feel great. And I'm reminded of, my fun loving self. And then it hits and it's just unrelenting for the
Mhm.
rest of that month. And then I get that week again and I'm like, oh, I can handle this. And then, it's like Groundhog's Day.
It is, and I think the trouble is as well, just in terms of the management side of things, we need awareness of adenomyosis, that this is the case. It's not just a bad period, that age. For those that most people don't know about it, and those that do assume it's a period thing, which it is, but it's actually very much a month round lifestyle thing as well. And, saying that you're in pain most of the time, people can't handle that. People can't grasp that. But actually, there's days that it's absolutely awful. And I'm sure you're probably the same. I certainly do this. I only mention it to
Oh,
those around me if it's really, really bad.
okay.
I don't mention the low level stuff. Well, I call it low level pain. That if it was in my head or in my arm or in my foot, I'd be whinging about like nobody's business. But because it's daily, you can't afford to. You
Mhm.
can't, because you'd get so bogged down with it. But
Right.
I think the wider population and those that don't suffer from this, just knowing that actually it's 60, 70% of the time is crucial, because people might be a little bit more forgiving and a little bit more understanding as well.
Oh, you are amazing. Thank you.
Oh, thank
you for
you.
everything you're doing. And I can't wait to have you come back and talk a little bit more too about your powerful post and how you put out pictures that help us celebrate their bodies at all different stages of endo and adeno.
Oh, bless you. Thank you. Thank you so much for having me on. And thank you so much for bringing some individual acknowledgement to adenomyosis, because you're probably one of very few that are.
Thank you. I'll talk to you soon.
Speak soon. Thanks so much, Diana.
Thank you. Be well, Rosie.
Thanks.